What is going on, Walk-ins? Welcome, family. We're glad to have you back for another episode. It is Wednesday, so we're dropping another new one. I'm Nick. This is Michael. We have a guest with us today that I'll introduce in just a second. But as always, we're here to help you get more patients, deliver better care, get repeat visits, and scale your clinic. Michael, what's up?
Yeah.
Tell us about Dusty here.
Yeah, absolutely. And I'm excited to have an interview back on. It's been a little bit of a gap since interviews, so we're glad to have him on. Met him at the UCA convention in Vegas.
We've been hearing about that nonstop since we got back.
Yeah, we already got feedback of people laughing at what we said.
That's right.
And then we made them feel bad about some things. But anyway, there you go.
It's not our fault people are short.
No. All right. So Dusty Schroeder, he is a co-founder of Cowork Health. He's been in this industry for a long time. He started in DocuTAP in 2007. 2020 came around, which we all know what 2020 means. So COVID's a thing. But in 2020, he co-founded Cowork Health. And what is Cowork Health? It is basically designed to help you do OccMed and do it well. It goes from invoicing, turning paper to digital, just a modern platform to collaborate on. There's more things coming for it soon. But Dusty, I'm glad to have you on. And I know our listeners are glad to hear this because we've been chatting about OccMed for a while. And if you can make things easier for them, they're going to appreciate it.
Dusty, say hello to the Walk-ins Welcome fam and tell us one thing about you that nobody else knows.
Awesome. Yeah. Hey, everybody. This is really relevant for me because I love podcasts. So I'm going to keep it relevant and say the one thing nobody knows about me. Some people do. That's close to me. But I can listen to podcasts at like 2.5, even 3x speed pretty easily.
Oh,
it
no.
sounds
what
normal.
Does that sound like?
So, yeah, I can knock this out in like 10 minutes if you want. I can talk at that pace or I can listen. But I listen to a lot of podcasts. So.
You know, it's funny. We always try to keep this thing around 30 minutes, and I don't do it at 2.5 speed. We know a guy that owns, or at least is the founder of Go High Level, which is a marketing platform for agencies like us.
Oh, yeah.
And his normal talking voice is 2.5 times speed. Everybody else.
It is.
That guy is rocket fuel.
Like you watch that chin moving, and he's just firing off. And
hey, what's up, everybody?
Yeah. And he's like super energy.
Let's go.
All right. So what you're saying is you're constantly operating in slow motion, but you listen to everything in fast forward.
There you go.
I like it.
Yeah.
Well, man, we're glad to have you on the podcast. And I'm really curious to hear more about coworkhealth.io. And really, it's relevant right now because we just did an episode a few episodes ago talking about adding occupational health as a service as part of your urgent care. Mm-hmm. And here you come along. We meet you at the Urgent Care Association convention. And you have a software that helps urgent cares and of course, other clinics and businesses. But we're going to talk to the urgent cares, how to incorporate this in and have a system and a platform to help deliver that care and bill properly. Before I get into the details, man, tell me all about Cowork. What is it? How does it operate? Whatever you think would be at a 10,000 foot view.
Yeah. Why do people want this?
Yeah. 10,000 foot view. So, I mean, like Michael said at the beginning, I've been in this space a long time. And so, there's some software companies that they kind of look for a problem to solve. We didn't seek this problem out. I worked for an EMR company for 12, 13 years, and we heard these pain points over and over again. EMRs, we focus mostly on patient billing, insurance billing. OccMed billing and communication is a different beast altogether. So we understood the pain points, but it just never bubbled up as a priority. And so that's why we founded Cowork Health. Cowork Health is really meant, like Michael said, to modernize the OccMed relationship management to make it much easier. One of the biggest pain points is billing because the billing is different, again, than patient and insurance billing. So to make that really easy and modern, let clients pay online, have automated reminders, things like that. That's the key goal there is to get that cash flow for OccMed flowing at a less than 30-day rate. And it does a lot more than that, but that's the key goal we started with. Like, how do we make that invoicing and collection process way easier?
So the number one problem you were trying to solve early on when you first founded this is like, let's get our doctors paid. What they're used to doing is coding and having insurance basically reimburse. And occupational med or OccMed, I'm going to say from now on OccMed. We're going to save ourselves.
Our people know what that means.
So when we say the billing for that, you're invoicing a company or a corporation. They're reimbursing you that way. It's totally different.
Yeah,
right?
That's right.
And that just doesn't exist in a current EMR.
Well, it's almost like one of those, like in a business world, because we're just a regular business, right? Like we understand that process, but when you throw that into a medical situation, it's just kind of foreign language, right? Because like, why is this so much different? Like, why am I waiting on an invoice to be paid out? Things like it's just a different world.
Yep.
What's the biggest question that you get in relation to this when you're talking to a doctor, physician, whatever, who's wanting to add this service or has it in place? Like, what are they asking you that triggers this is the solution?
Well, almost everybody is still mailing their OccMed invoices because of that. Wow. And so that's the first thing,
that
right?
Makes me sad.
That's sad.
or if they're emailing them. So the other thing, so you said, you're right. I mean, it's like a business, but these invoices, they still contain PHI, protected health information, right? And so they still need to have a login or be encrypted. And so the way these EMRs or different systems are sending it is really not user friendly. It's like a one-time passcode. You can't see the status of the invoice. You typically can't pay for it online. So you have to get that in an encrypted way. So the number one question typically isn't that. I mean, people see the value pretty quickly. Like, we can save you a lot of time and effort and money just from sending those out alone, if that was the only thing we did. The number one question with a lot of systems is typically, do you integrate with our EMR? How do you connect with our EMR, right? And so that's always the biggest question, always the biggest hesitation with any one more system, right? And so we knew that going into this, having worked for an EMR company. And so we have since the beginning been really creative with how we use our technology to make it work, even without a true integration. And we're getting there, but even without true integrations, there's a ton of value to be had.
Well, just from the marketing world, we constantly have to bridge gaps between softwares using, Zapier, if you're familiar with that. But you're talking about integrating with different EMRs. The ones that we run into all the time are going to be Experity and Clockwise, Athena Health.
Yeah. Those are the top ones we see a lot of.
Urgent IQ.
Yeah, there's quite a few out there.
So are you reaching out to these companies, or are you building where your platform does this auto integration through APIs, or how are you integrating?
We have talked to a number of these companies. So if you don't know, DocuTAP is one half of what became Experity Health. And so DocuTAP, Practice Velocity, they became Experity Health. And so we know a bunch of people over there still. We've talked to that crew, the right time, the right place. I'm sure it will happen. But the other ones too, like our motto is really, we want the clientels to go to bat for the integration. So once enough value is had, once there's enough, groundswell from the client base to ask for that, for the EMR, that's when it makes sense for everybody, for the EMR and for us and for the client to put the time and effort in to do that. So
it's that local voice. I'm with you on that. It's not so much that they're doing anything to serve you at Cowork. They're really serving their customer by adding this integration on their behalf.
Yeah,
that's right. Yep.
I love it. That's very good. All right. So you mentioned a new OccMed CRM component that's going to be integrated into Cowork. Let's talk about that. For those who don't use a CRM, what exactly does that mean for a clinic, and how are you rolling this out with Cowork?
Yeah, so we already consider ourselves an OccMed relationship management platform. And so what that means, though, is it can mean a lot of things. But what we're talking about today is you can manage your current client base today. And so whether, again, that's invoicing, sending secure documentation, results, authorizing services, or just communicating, that's with your current client base. How do they become a client, though, right? Like, you need to manage that journey. You need to record activity. You need to make sure people are getting followed up on. Right now, people are still using spreadsheets. They're using Salesforce. They're using different CRMs that aren't, again, it's one more system. It's typically over-engineered. It's expensive. And so it's a natural segue. We always thought we'd get here. And so this is the year we're going to get there, where we're going to add a CRM component within the same platform where you can record and track your sales, your prospecting activity, and then very easily turn them into a client all within the same platform. It's all going to be secure, HIPAA compliant, all that good stuff.
So you're speaking our language, right? Because this is marketing 101. It's because I think that's what we talked about in the other episode about OccMed in general. Like, it's a true sales job to go get these OccMed relationships. Like, it's not a knock on a door, make one phone call, and you all of a sudden got a new OccMed person, because you're dealing with the managers at a company that don't have time for you. And so they want that they want that professionalism tied around to it. Like in our world, so CRM world, like our preferred CRM is high level. Like that's what we utilize mostly for all of our clients. Do they use it? No, they don't. But we use it and we enable them to use it. But
they're using Solve and Experity and all that kind of stuff.
Yeah, exactly. But at the end of the day, when you're relying on, like you said, a spreadsheet, which is too primitive, right? Because you can lose stuff so quickly. Then you move over to a Salesforce. There's too much going on. and then they want to charge an arm and a leg to customize it for whatever you're looking for. And then you have the HubSpots and all the other things. And those aren't really designed for medical, right? Like they're not really there for medical. They're for normal business, regular general business. But to me, it'd be amazing. So like you track all this potential, this prospect in your CRM, and then you say convert to client, and it just pushes them right over to the other part of the software, and you don't have to do anything. Like that would be like ideal for so many people. And it's just simple, because when you have systems that don't talk to each other, it's just a lot of wasted time.
For sure.
When you have a system that just talks and does everything, it makes it so much better.
So Dusty, you said that you can help clinics save time, save money, even make more money.
Yeah.
Let's talk about how the software does that specifically.
Yeah. So, I mean, I actually just did a post the other day where, with OccMed Health, with the normal process, if you're mailing or even emailing, you're typically getting paid at best at 45 days. Typically it's in, 75-day average, typically what we hear from clinics. And that's of the build out that they even know about. We often see our clients get their average to be less than 30 days. So that alone, just getting your cash flow basically cut in half, where you're getting your revenue in the door way quicker. And then you're typically getting way more of that. So how that happens is, one, you're not mailing them. So basically you can send all your invoices, whether that's 10 or whether it's 1,000 for that month. You can send all those invoices electronically. You can get paid that same minute if you want. We've seen that happen. People send their invoices out. They're getting paid within the same, hour, same 5 minutes of getting that sent out. So they're getting cash flow in real time. Not everybody, obviously, but it's starting to happen.
That's the best feeling.
Yeah.
When you fire off an invoice and it fires back being paid.
Yeah.
I love that.
So that's part of it. And then the other part where people either spend way too much time, they waste time doing this, or they don't do nearly enough of it, is the follow-up, because people aren't going to pay you always. And so what do? They pick up the phone, they send a one-to-one email, and they do that hundreds and hundreds of time every month. Well, our system, since you're now sending them electronically and securely, you can set up whatever automatic reminder schedule you want. And so you can remind them, hey, still got an unpaid invoice. Hey, still got an unpaid invoice. And most people want to pay. They just lose sight of it. And so if you do that, a few times, typically our clients aren't doing any manual follow-up until that 90 plus or 120 day plus date at that point.
That's good. All right. Well, look, you've got lots of background coming back all the way from 2007 and where you are today. Just doing some reflection over your career, like what's led you up to founding this company? I know what you were trying to solve, but like, what's your heart behind it?
Yeah, because I imagine this industry has changed quite a bit since 2007, for good and for bad, I guess. So I'm sure there's lots of motivation behind all of this.
Yeah, I mean, the funny thing is, it probably hasn't changed enough, right? Like, I think we all agree, like healthcare just moves too slow, and we're trying to speed that up a little bit. But no, I mean, like me and our entire team, like we have a small, nimble team of founders, and we're addicted to like solutions. When you get somebody using a product and they say, this has changed the way I work, this has improved our work so much, this has helped us, this has improved our revenue, like getting that feedback is addicting. And being an approval junkie, being someone with like imposter syndrome and needs people approval constantly, like getting that feedback, that is what drives us. Like we want to be everybody's favorite platform that they use in company, hopefully, but that's the goal, right? I'm not saying we're hitting that all the time. Not saying that's always doable, but that is our goal. It's like we want to be in their clinic and we want to be their favorite platform that they use.
So there's a lot of software that everybody uses. All right. So
we have 50 that we pay for.
My goodness. Zapier is a godsend, but at the same time, like I'm constantly looking at other softwares and I'm talking myself out of other softwares all the time because it's one more login, one other thing that I have to keep up with, one other place I have to click over to, and another time suck to learn. Tell me a little bit about specifically with the taking time to learn. What does your onboarding process look like? So a clinic says, hey, we're already doing OccMed. There's got to be a better way. Let's talk to these guys. Start me from the phone call or the click all the way through them onboarding as a client. What does that look like?
Yeah. I mean, in our deck, even we say we can get you live in three weeks or less. That's what we say. That's typically because of the clinic and not because of us. We can move really, really fast. The things that slow those things down are typically just gathering the client list and things that you need for upload. And we typically slow that down for them too, because we encourage them to do some communication with their current client base that they're doing OccMed with. Say, hey, this new system's coming. This is what this is going to allow you to do with us once we have this system live. That pre-communication really helps adoption right out of the gate. When they go, we help guide them through that. We have some guides that we give our clients to say, hey, this is how you can communicate with them. Use it however you want. I'm sure you guys have experience with that too, but use this communication. You can edit it. You can do it differently, but this is a schedule we've seen.
They throw it straight into ChatGPT and say, rewrite this.
Yeah, right. Yeah.
Sure. We just had that today.
Yeah, no, but it's super simple. We're not implementing an EMR. It's not super complex. You can kind of tiptoe into this if you want. You can start with just invoicing and add other things later on. You can start with your 10 best clients to start and then add other clients later on. So really, it's like, how quickly do you want to do this? How eager are you? We can move as fast as they can typically, but it's typically less than a month.
So we've spent a lot of time. That's awesome time frames. We've spent a lot of time talking about the billing and all that kind of stuff, which seems to be the number one part of the solution.
It's got to make money, right?
Yeah, exactly. Well, it's got to bring in money.
Bring in the money.
Is it doing anything to help them make money from the CRM perspective? Like, is this managing relationships with prospects, email systems in place, or is that past? Am I thinking too far ahead of what the platform does?
I love what you're thinking. We're not quite there yet, but once we have that CRM component, that's the other thing our clients tell us they're really excited about, is because it's one system, but the other thing it's going to allow you to do is you'll be able to attach the revenue since you're sending invoices through the same platform. Mm-hmm. Now you'll be able to attach, okay, who sold what? Did they become as big of a customer as we thought they would be, right? And so you'll be able to attach that revenue directly to that client once we have all that in place. But yeah, we don't have that CRM yet, but yeah, in time.
What I love about it is, from the marketing aspect, we help our clinics get new patients through the door like lots of times a day, 20, 30 times a day. Like we're bringing new patients through the door. But it's a completely different process from bringing a business to consumer or a business to patient than it is a business to business. It takes longer. You can't just run an ad. You have to have conversations with people. There's a relationship component to it. Go ahead.
I would say it's a time thing. Like, it's so rare. And I even say to our urgent cares, like, if you don't have somebody in your office dedicated to follow up, you really shouldn't pursue OccMed unless you already have the relationships already there, lined up, ready to go, and you're just turning on a switch. But most of the time, it's because we do this. Like, when we go after urgent care, like, this podcast exists to help pick up urgent care clients for us. Like, we get that, we talk about that. But like, it's building that trust, because businesses have to trust you. They don't just say yes the first time. And I think sometimes urgent cares may miss that, because in the urgent care world, it's volume. Volume. In OccMed, it's not really volume. Like, you may only need 10 good clients that produce hundreds of people.
That, it's frequency.
Yeah, right. So it's just a different animal. And I love that, because talking about don't need too many softwares, but I love the idea, like, they don't have to say, oh, well, because we see this, oh, they finished up in high level, now we got to move over to our QuickBooks, move over to this, move over to that. And we literally have a person, that's all she does, right? Like, it's get that migration as a new client over, and instead of just a click. So, I think it's awesome.
Yeah, I mean, we've seen some, clinics that are hesitant to do OccMed too, because they think the per visit rate can be less than urgent care, and it can be if all you're doing is like collecting drug screens all day, and that's all you're doing, and that's what you consider your OccMed program. But I've also talked to people that have really successful OccMed programs, and they're like, I can make more per visit doing OccMed than I do in urgent care, but they're dedicated to it. You're right, like you said, Michael, they got someone dedicated to that, at least one person dedicated to doing that. They are talking to those businesses all the time, saying, what can we do for you? What else can we do for you? Right. And making it really tailored for those companies, or at least seem like it's really tailored for those companies. That's one of the things, right? Just perceptually making it like, hey, this is what we're doing for you specifically, and this is how we're keeping you safe, and really taking things off the HR person's plate for that company, or whoever on that company. Like, if you can say, let us handle that for you, they're going to remain a client of yours for a long time.
Oh, yeah. They customize. The second that an urgent care can make it easy for the OccMed client, they start to win. I mentioned this in the other episode about this, but the example I had was I know an optometrist that got a deal with like a Honda manufacturer to do all the eyeglasses for all the workers there. It's like 800 people. And he got the deal because he built a trailer that he would roll up in front of the factory and then just cycle through like an entire day. And so the downtime for the Honda manufacturer was like 10 minutes per employee, which was ideal. They didn't have to go drive somewhere or anything. They just walk outside. Yep. So like that's to me, you got to think outside the box. You got to be a little bit different. You got to tailor your needs. If it makes sense to, sometimes it doesn't make sense to, but like we have other urgent cares that they sectioned off part of their facility to just do OccMed. So it's a more streamlined process. Cause I think at the end of the day, the value that you're trying to give to that client is just, are you saving me money or not? Like, cause I have to do this anyway. I have to do drug tests. I have to do this anyway. Are you giving me the best bang for my buck? And you're keeping my downtime limited, and you're making it work for me where I don't have to question it. Because we all know this. When we bring on a vendor and it feels like we're having to be too involved, it's a mistake. Like if we're trying to fix things with the vendor on a regular basis, we probably made a mistake in the vendor.
Yeah, I mean, saving money, though, from an employer perspective, saving money is definitely a big part of that always. But from what we've seen, it's really on top of that. Are they getting the results in a timely manner? Is it easy to pay their bill, to understand their bill? Is it easy to request services? If I have a question, how quickly are you responding to me? It's that typical relationship management stuff. Like if they have to work, you've kind of said it there. Like if you have to work to get the stuff you need from the clinic, like I'm willing to pay $10 more per visit if you get me the stuff I need when I want it, right? But it's when it's delayed, when I got to ask 3 times, when I don't get the response, it's really hard. And that's one of the ways. So another way Cowork empowers these clinics to kind of customize that service per company is you have to authorize a service when you send an employee in, right? Typically that's a paper form still. It might be a PDF, a generic PDF on a website, but typically the employer fills it out. Here's what services we need for John Doe coming in, give it to the employee. Hopefully they remember to bring it in, right? And then the front desk person has to translate that back to the EMR. So in Cowork, you can have authorizations that are obviously digital as well. And you can make those specific to the agreements or the protocols you have in place for those companies. So you can make them very specific, very unique, and say, hey, these are the 4 services we do for you. So you don't have this auth form with 50 services you need to pick from. It's these 4 services. Which one do you need today? Right. So that's also in the platform, makes it easier for those clinics to kind of deliver that VIP experience to the clients.
So I have a feature question or request. We'll see if it's there or not. I think it would be talking about the CRM side and connecting the two, but the idea of if the main software recognizes a OccMed client and it says, we haven't sent, it's been a year since this has happened. We need to send a reminder out that they need to request this information. And they let the CRM send that reminder out or whatever as like a upsell opportunity. Because people, if you don't, set a meeting from a meeting, set an appointment from an appointment, they're not going to do it. Right. And so like it sends out those reminders. Hey, it's that time of the year to get the whatever test for these employees. We have slots available. Please click here to confirm them. Like something along those lines.
We do not have that yet, but it's
a request,
an incredible request. It's something we've thought about a little bit, but I mean, like a DO2 physical, for example, like those, certifications end in certain time frames. So if you see someone come in, they got their DOT done, I can't remember if it's 1 or 2 years later, they're going to need to do that again. Right. And so if you could remind them to do that and come back in at the right time, like absolutely. I love that thought going forward.
Yeah.
With CRM.
Send the schedule right along with the email and say, pick a time to go ahead and do this. I mean, it's the same thing like when our Google Ads certifications come up, you get that email that says, hey, you need to renew in 30 days. Please click here to start the renewal process.
Well, I don't know if you heard me rattle it off right at the beginning when I was talking about more patients, better care, repeat visits, scalability, right? Yeah. So repeat visits is a key ingredient to the success of an urgent care and especially occupational medicine.
Oh yeah.
It's a key ingredient. It's a key ingredient to profitability and scalability. All right. So real quick, and then we'll wrap up. I want to know where you see occupational medicine going maybe over the next 3 to 5 years.
Yeah, I mean, that's a great question. There's been a lot of change and movement in the market about who will provide OccMed services for companies. A lot of health systems or different groups are deciding either not to do it or to go all in. And so I think there's going to be a lot of change over the next 5 years between all the hiring practices and whatever the job market does. It always changes the market as well. But beyond that, the next 5 years, I really think, like everything else, you're going to see a big lean into technology. How is AI going to impact that, right? What can we automate as part of that process? But people are still going to need services. Still going to need drug tests. They're still going to need physicals. They're still going to need these things to get hired at these places. So the great thing is OccMed's not going anywhere. Like if you want a consistent revenue stream for the year when your summer is slow in urgent care, Occ Health, if you want to lean in, stuff we said earlier, it's a great way to get a consistent revenue stream for the year.
Urgent cares, listen, did you hear that? When your summers are slow, your OccMed can fill the gap every time.
Yeah.
It really can't, because OccMed's not about being sick. It's about all these other things that has nothing to do with seasons. And so it's because we see that too, because like we're a recurring model, right?
Mm-hmm.
Like
that's right.
People that we bring on, we're on a recurring management fee with them. That fills the gaps. Like, if we weren't on recurring, we're just relying on project base. It's hard. But when you know that revenue's coming in, especially when things change, it's fantastic. I mean, same thing in the software world. You guys are looking at recurring pieces. And just real quick, I don't know how much you can talk about pricing, but what kind of pricing are they expecting out of this?
Yeah, I mean, I tell you the pricing model. I mean, we are a pretty cost-effective solution because we're trying to be small and nimble and really hit this one narrow niche within urgent care, right? And so our rate, we give you a flat per clinic rate and give you unlimited usage. You can add as many companies as you want, as many users as you want, send as many invoices you want, put as much documents as you want in there. And so we make it really affordable. And depending on, what features you want, it can be a really low cost solution for you.
Nice. And it's flat rate too. That's the best part. You don't have to worry about, I just brought on another one that just cost me.
Yes. I feel like every software I ever use is like per person,
per usage,
per seat, per whatever.
Yeah.
And you have a flat rate with that. And that ties into our fourth kind of tenet of that scalability. Man, there's nothing more scalable than a software that doesn't increase in cost based on your scale.
That's what we love about like high level. We pay that one fee and we have a lot of sub accounts underneath that one fee.
Just to be clear, a high level has nothing to do with Cowork. It's not even a competing thing at all. But I do want you to go to coworkhealth.io. That's the main website. What I like is that you can get kind of a 2-minute overview of what the software is. And then if you like what you see, you can hop on a live demo with them.
Yeah.
If they're as non in your face as Dusty is, you're going to probably have a good non-salesy experience.
Yeah, right. It's just going to be like, tell us what's going on. This is how we can help you. If it makes sense, here's the price.
And that just vibes like perfectly with how we operate. So why don't you, Dusty, we'll wrap up. Tell us a little bit about how people can connect with you directly and what a next step would be if they're interested in talking to you.
Yeah, I mean, I'm most active on LinkedIn. If you want to find me in there, my email is super simple. It's Dusty, Dusty at coworkhealth.io. But yeah, like Nick and Michael said, go to our website. You can get an overview there. You can see client videos. You can see a really quick overview of what we're trying to do. And yeah, I promise you, if you hop on a call with us, we do not sell. We will sell you. We will tell you what we do, what we provide. Let you talk to clients if you need to, and let you on your way. We know how busy you are. So.
Nice.
That's our kind of people, man. Dusty, thank you for being a guest on our podcast today. I thought it was great value and right in line with where the market's going in the urgent care space. Occupational medicine is a hot topic, and you guys provide an amazing service and a software to help meet a need that is growing.
Yeah.
Appreciate you being on, man.
Yeah, thanks for having us.
Last parting words, you good?
Appreciate it.
All right, man.
I'm good. Thank you.
We'll talk to you soon. Thanks.